When I was about 9 months old, our family was forced to go into hiding because we were Jewish. And I was placed with a Dutch Indonesian family, and I spent the next 3.5 years with that family. Fortunately, my mother survived a total of 12 concentration camps, and I was reunited with her when I was about 3.5 years old. And so I grew up after that in all the remnants, really, of the Holocaust and all the destruction of World War II. But nonetheless, my mother was able to give me what I would call a very happy, carefree childhood. When I was about 6 or 7 years old, I had a ruptured appendix, and I ended up in the hospital for about 3 months. That's sort of when I made the first decision to become a doctor. One of the very first patients I took care of was a very elderly Puerto Rican man with severe asthma and emphysema. And he was extremely short of breath, and I used whatever equipment we had at the time to help him breathe. But unfortunately, sadly, this man died, literally, in my arms. And that's when I made the decision, really, to become a lung specialist. I decided that whatever I did in my practice, I also wanted to contribute to changing the terrible statistics, the terrible toll that tobacco was taken on our citizens.
When I first met Al was first a volunteer with the American Lung Association, then the president of the American Lung Association, just at a time where people began to realize the power of public policy advocacy and the voices of pulmonary experts in changing America's attitudes. He was a critical voice in convincing members of Congress that they had to tackle the tobacco problem. He was a critical, credible voice with skeptics at a time where the tobacco industry still denied that its products cause disease and even more vigorously refused to admit that secondhand smoke killed. Al is one of the reasons that more members of Congress decided they had to act than almost any other single individual.
When I first met him right away, it was clear that he was passionate about doing something about tobacco control. He was so keenly aware of the harms tobacco products cause to the human body as a pulmonary physician that he had a very, very strong vision about what could be done.
Dr. Munzer, one of the kindest, gentlest, most passionate advocates I've had the privilege of working with. He always brought his A game to an event. He shared powerful stories. He stood up and told the truth to power, and he brought his passion to his work.
His unconditional support to my region helped me instill confidence in myself and my work. Having him be a strong supporter behind the scenes, letting others shine and celebrating people's successes showed great humility on his part, and as well a genuine desire to uplift and help others.
He absorbs so much knowledge. He imparts that knowledge to people with so much care and so much attention, not just to what he is saying, but to where they are coming from, what their background is.
We experience Dr. Munzer's legacy every time we get on an airplane.
Al was an incredibly critical voice in the movement to ban smoking on airlines, one of the most credible voices in Congress and one of the most persistent. Al's leadership in that battle is one of the reasons we all now can't imagine smoking on airplanes.
The tobacco control community, the International Tobacco Treaty, we owe a lot to him and to his role of this visionary leadership that he had, which was way ahead of his time.
He was just willing to show up and do the hard work.
He had the ability to tell the story of the impact that tobacco was having on the lives of millions of people around the world. And I really think he was instrumental in getting a strong FCTC passed.
The curiosity to understand the fullness of people suffering.
Someone who really believed that everyone has something to contribute.
What makes him passionate about the work? That's just the way he is. It's the way he grew up. That's the way he decided to go into medicine and get involved in various organizations dealing with medicine. And it's just Al.
One of Dr. Munzer's great strengths was his longevity in tobacco control. For more than 2.5 decades, he was a national leader for the American Lung Association. And then he moved to ASH to continue his work on his passion around the Framework Convention on Tobacco Control and more. Few advocates can match Dr. Munzer's longevity as a volunteer servant leader.
Al is the model citizen advocate.
Dr. Munzer is just an amazing diplomat.
He cares about people. He has a powerful life story. He overcame so much to become a leading physician, but even more so to become a leading advocate for the people that he serves.
Al is so effective because he understands and empathizes. He can make the problem feel as human as it actually is. He can translate the science into something every individual can understand and make them appreciate both the personal harm caused by tobacco and the extraordinary benefit of acting to reduce tobacco use.
And I think he brought that passion for a better world, for this ability for humans to work together even when they have differences. And that thing was really critical in the context of an international treaty negotiation, for example, where that type of kindness, that kind of openness to everyone in every culture was really, really helpful.